Hello everyone, my name is Jake Della Pietra, and in this video presentation for Dr. Cody's microbiology class, I will be presenting Toxoplasmosis. Now you're probably wondering what an anthropomorphic protozoan parasite, a cat, and a pregnant lady have in common, but I promise that if you stick around through the duration of this video, it'll make sense. So what is toxoplasmosis? Well, it's an infectious disease caused by the single-celled protozoan parasite Toxoplasma gondii, one of the world's most common parasites. Infection is typically spread through consumption of undercooked and contaminated meats, exposure from infected cat feces, mother-to-child transmission during pregnancy. The parasite can exist for periods of time in humans, extended periods of time in humans and non-human animals. However, very few infected persons, although many, actually experience symptoms. Pregnant women, infants born to infected mothers, and immunocompromised persons could incur serious health problems. Bit of historical anecdotal information for you. The parasite was first discovered in 1908 by Charles Nicole and L. Mancio. They discovered the parasite in a North African rodent they were examining called the Ctenodactylus gondii, and then the parasite was named about a year later. It was named Toxoplasma because of the parasite's crescent shape. Toxo, the toxo part of the word, comes from the Greek toxon, which means bow or crescent shaped. And the gondii portion of the parasite comes from the original rodent host that the parasite was discovered in, called the common gondii, which is seen on the left here. And this is just a nice image, nice microscopic smear showing the parasite in the acidic fluid of a mouse. You can see its crescent shape all over. Some stats from the CDC. As of 2018, at least in the United States, about 11% of the population ages 6 and older have been infected with T. gondii. About 60% of certain populations in other parts of the world have been infected. And these areas of the world include Central and Southern Europe, Africa, South America, and Asia. These areas, particularly because these parts of the world have climes and living conditions that are beneficial for the parasite. Hot, humid climates with a generally lower altitude. There are 3 main routes of transmission for the parasite. The most common being foodborne, the second most common being zoonotic or animal to human, and the third most common being congenital or passed on from a mother to her child. So some information about the foodborne route of transmission. A microscopic cyst comprised of bradyzoids or tissue form of the parasite is transmitted to humans through food. This can be done through direct consumption of undercooked, contaminated, or raw meats or shellfish, the most common being pork, lamb, venison, oysters, clams, and mussels. Through accidental ingestion of contaminated meat or shellfish due to improper handling of food products, such as failing to wash one's hands after handling raw meats and shellfish, so always wash your hands when cooking anything, really. The parasite is not transmitted. It's important to know that the parasite is not transmitted through, or absorbed rather, through direct skin-to-skin contact, but rather through direct or indirect ingestion. Consumption of food contaminated with kitchen utensils that came in contact with the parasite are also a way that the parasite can transmit itself to a human. So always wash your kitchen utensils, knives, spoons, forks, pots, pans, countertops, cutting boards, things like that. And as you can see on the left here, this is just a little image from this CDC citing how the disease is a leading cause of death from foodborne illness, at least in the US. The second most common, or the zoonotic or animal-to-animal route of transmission, is really dominated by cats. Now, cats are responsible for contracting and spreading this disease because they become infected themselves by the small animals, rodents, small birds, mice, rats, things like that they eat. The parasite is passed in the cat's feces in the form of a microscopic oocyst. Cats and kittens alike may shed millions and millions of these oocysts in their feces for up to even 3 weeks after their initial infection. And so then humans can be infected in this way, if they own cats, that is, while cleaning their cat's litter boxes, after touching objects or items that came in contact with infected cat feces, infected litter containing infected cat feces, through accidental ingestion of oocytes in contaminated soil that was tainted with cat feces and urine, really just cat feces. So let's say you own a cat and it went outside and used the bathroom outside. The parasite could then go from the cat feces into the soil. You go outside and you pick some produce maybe from your garden, or you pick up an object that touched the infected cat feces in the soil, and now your likelihood of picking up the parasite is much greater. And then also from drinking contaminated water, that's another way to get it. The third most common is actually through pregnancy, congenital transmission, or transmission of the parasite from a pregnant mother to her child, her offspring. The pregnant woman who is infected with the parasite immediately before or during the pregnancy can pass the infection, the disease, to her fetus, although she herself might not show any symptoms or signs. The child may or may not, depending on how early or late the woman in her pregnancy was when she contracted the parasite. The child can show certain signs and symptoms, such as seizures, confusion, jaundice, severe eye infections, hearing loss, mental disability, and sometimes even stillborn death can occur. So this is just a nice diagram summarizing the overall structure and life cycle of the parasite. One of the stages of the parasite is called the sporozoite, or the oocyst. Another stage is in the microscopic tissue form cyst, a tissue cyst called a bradyzoite. And then another form of the parasite, or stage rather, is in these groups or clones known as tachyzoids. So if you just follow me over here on this diagram, starting in the lower right-hand corner, we see these sporulated oocysts or sporozoites, and they are typically found in feed, water supply, or soil. They're contaminated in that way. And then this food, water, or soil is ingested by intermediate hosts, such as livestock here, or the small rodents such as mice, rats, chipmunks, and small birds that are part of what really make up the cat's diets. They can act as intermediate hosts as well. The parasite then goes into its tissue cyst form, or its bradyzoite form, and it can be picked up by cats that way. Or the tissue form, the bradyzoite form, can be picked up by humans after ingesting infected undercooked meats, raw meats, and shellfish, things like that. And then the sporulated oocyst can also go can contaminate food and water supply, and that's how cats or livestock or humans can also pick up the parasite as well. And then specifically the groups or clones infectious stage, known as the tachyzoids, those can be transmitted from a pregnant mother through her placenta, which is seen right here. Now, symptoms of the disease, as I said previously, while most individuals show no signs or symptoms of this disease, even though the parasite is so common, certain individuals with weakened immune systems, immunocompromised individuals may show signs and symptoms such as body aches, swollen lymph nodes, headaches, fever, fatigue, flu-like symptoms, mono-like symptoms. Immunocompromised individuals include cancer patients, chemotherapy patients, HIV/AIDS patients, and even patients who have recently received organs through organ transplants. And these symptoms can be a bit more severe, including confusion, headache, lack of coordination. There's even an ocular toxoplasmosis and lung problems resembling TB or pneumocystis jirovecii pneumonia. The disease is typically diagnosed through serologic testing, through searching for certain antibodies in certain bodily fluids such as blood, lymph, and most particularly serum. And the antibody that's generally looked for is immunoglobulin G. However, in pregnant women, immunoglobulin M is the antibody that's generally looked for. Other ways of diagnosing the disease include stained tissue sections, biopsy material looking for the parasite, cerebrospinal fluid, isolating the parasite from blood, lymphs, and cerebrospinal fluid, although this method is more time costly. And then the ocular form of the disease can be assessed and diagnosed by an ophthalmologist when looking at lesions in the eye, general symptoms of the disease, and serologic testing as well. Treatment options for those with the disease or those who are aware they have the disease. Most individuals, as long as they're generally healthy, even though they have the parasite, they can generally recover on their own. Their immune system is able to fight it off. However, those with suppressed immune systems may receive certain drugs that can be effective, such as pyrimethamine, sulfadiazine, and folinic acid. Pregnant women, newborns, and infants may receive treatment from these types of drugs as well. However, the drugs in these individuals might not be as effective because the parasite remains in tissues in a less active phase, and location of the parasite makes it really difficult to eliminate. So the matter of assessment and treatment at this point for pregnant women, for their newborns and infants, really becomes a judgment call of the physician. And then those with the ocular toxoplasmosis form of the disease, again, prescription drugs can be prescribed by ophthalmologists, and treatment and overall assessment depends on the size, location, and characteristics of lesions, which are on the retina of the eyes. So how to prevent getting the parasite in the first place, how to control it, how to manage it? Well, generally avoid consumption of undercooked raw meats and shellfish as best you can. Wash all of your kitchen utensils and supplies when cooking. Thoroughly wash your hands when cooking with warm soap and thoroughly wash your hands after cooking with warm soap and water, and wear protective gloves while gardening or laboring in soil. Finally, you might want to put a protective covering over your sandbox, especially if you have small children, because cats, and being an owner of 2 cats, are very likely to mistake anything that feels like their own litter for their actual litter. So what about kitty? Well, for those individuals who are at a greater risk of contracting the parasite, preventative measures can be taken, but don't worry, you don't have to get rid of your cat even if you think or know it's infected with the parasite. Just generally keep your cats healthy, keep them indoors, and feed them canned or dry food and not completely raw meats. And if you're one of those individuals with a suppressed immune system, have other individuals clean and maintain their litter boxes. And actually, there's a picture of my gargantuan cat here. And here he is with my brother. Here's my references, and thanks for watching.